Hello and welcome. I'm Leonaura Rhodes, results coach, author, and retired physician. I've been thinking a lot over the last few days about how I can help people in this weird time when our lives are turned upside down by coronavirus. As a coach, I have a wide network of friends and colleagues who are experts in their field. So I've decided to record a series of interviews to bring you words of wisdom from some of these people, because in these times we are stronger together. So today I'm delighted to bring you an interview with Dr. Joe Feuerstein. Thank you so much for joining me today, Dr. Joe. And I'm just going to read your bio very quickly. So Dr. Joseph Feuerstein, MD, or Dr. Joe as his friends and patients call him, is a board-certified family medicine physician who specializes in integrative medicine. And I have seen Dr. Joe personally, and he's an amazing doctor. So I'm really honored to have him on the show today. He provides comprehensive care for his patients, including access to alternative therapies such as nutrition therapy, acupuncture, and hypnosis. Dr. Joe is also author of Dr. Joe's Man Diet, Lose 15 to 20 pounds, Drop Bad Cholesterol 20%, and Watch Your Blood Sugar Free Fall in 12 weeks. A nice short title there. So thank you for joining us on the call today.
Thank you.
So Dr. Joe, I was shocked to hear the other day that you had coronavirus, but then I was delighted to hear a couple of days later that you were fully recovered. So tell us about your experience.
Sure. So during the week, I work as you kindly said, I work for Stanford Hospital. I also teach at Columbia, and I do integrative medicine. From time to time on the weekend, because I miss giving medications and drugs, I will work in the emergency department in another hospital. It's a very nice, good hospital. And the first weekend I was there, when we started getting corona from across the border with New York, I was clearly exposed. And within a couple of days, I had a very mild scratchy throat. So I wasn't, honestly, it's so subtle when it starts that you really aren't overly excited. But my colleague the next day, who works with me, who's also pregnant, said, Joe, please just go speak to employee health and get tested just in case, because you don't want to be infecting people, which she is obviously right. So I then went to employee health, who told me the best thing was to speak to my primary. The primary felt that because I was having a little bit of a runny nose and a very mild dry cough, these were the most subtle, not exciting symptoms to start with. She said, look, we want to know it's not any either viruses. Why don't we go to the emergency department? It's the quickest way to get things done. We can check you for flu. We can check you for other viruses. And we can obviously swab you for corona. And that's what I did. And then I was sent home. I looked perfectly fine. And I was sent home to be on corona isolation while we waiting for the results. And that was essentially, that was a week and a half ago. I was perfectly fine. I had a little bit of chills. I have to say that I probably would have taken time off work, which is uncharacteristic. I didn't take a day off for sickness in the last decade, honestly, so I don't really get sick that often. But this, I felt a little unwell, but nothing very exciting. I never hit a fever. I honestly felt by this time last Friday, I was feeling fine. In fact, I was exercising again, and I was thinking, this is just, let's get my result, let's get going, and on we go. And then we moved to Saturday morning. Saturday morning went in a very different direction. I woke up and immediately felt that I was short of breath, could not work out why I was short of breath, started playing mind games. Am I really short of breath? Am I not short of breath? Is this a panic attack? Any one of these things. But after a little while, one of the problems of being a doctor is that you don't always think clearly about yourself. You do a much better job looking after everybody else. So I took a step back and I said, what would I do if I was speaking to you as a patient, Joe, and Dr. Joe said, get you to the emergency room because we don't know what's going on and it could get much worse quicker and you're in your basement. That's not a good place to be. So while you still can go, off you go. So you have to call the emergency department because you need to tell them you're on quarantine because you do not want the world and their mother getting this if you do have corona. So then I make my way to to Stanford Hospital, which is where I work. I tell them I'm quite short of breath by this time. I remember they told me to park by the emergency department where the ambulances come. And when you get there, you can just walk in with your mask. I've got to tell you, and Leo, you know, I'm exercise like 5-6 times a week. I was having problems getting from my car and walking into the ambulance without getting very, very short of breath. And so I was waiting. A young ambulance crew from Darien comes out. They all looked absolutely shocked when they see this doctor going. Anyway, so they take me in and they put me, and obviously after that, they sit me down. They do a whole host of blood tests, which is necessary to do. They do a chest x-ray. They check the saturations on my oxygen in my blood. If that is low, we are gonna have a problem, and mine are completely fine, but I'm just not able to catch my breath. So everything comes back negative, and then they say, okay, what we need to do is a CAT scan, because you are young and healthy, why ever do you have shortness of breath? So they get a CAT scan, and about 20 minutes after the CAT scan, the radiologist calls the emergency department doctor and said, this patient has coronavirus, he has COVID-19, he has on both sides of the CAT scan, on the lower lung, left worse than right, you have a viral pneumonia pattern, which is typical what you see in corona. And there's nothing else that's going to give me that. There's nothing else that would possibly have explained my symptoms. So they just said, okay, so you've got corona, your saturations are good, you're looking good, your blood tests are fine, you're young and healthy, go home and get better. And so I went home, and over the ensuing 24 hours, my breathing improved. And then over the last 4 or 5 days, I have completely returned to normal. I have one comment, which is that controversially, my friends who are doctors, who are my own personal doctors, put me on the medicine that the president has been referring to, which is azithromycin and Plaquenil. I asked them to do it. I don't know whether the studies are big enough that everyone should do it, but I really did not want to go in another direction and end up going back a third time to the emergency department, and this time in extremis, which is what can happen. So I took the medicine, I finished it today, and human race 1, corona 0.
Excellent. That's really good to hear. And you shared with me before we started recording that you've just come back from a run. So I'm really
excited. I'm back. I'm back and I'm ready. Okay, corona didn't work. Nice try, boy.
Yes, absolutely. So I'm, delighted to hear that. And I think it's really good to hear for people to hear a story of somebody who's had this illness and has definitely been unwell with it, but recovered fairly quickly and is now back to normal, because that's not the stories that we're hearing in the news. We're hearing the sensational stories that are pretty scary.
Yes.
For everybody. And as you know, I used to be a doctor myself, and
You're always a doctor.
Say again?
You're always a doctor.
I know. I call myself a retired doctor now. But even with my background as a physician, and I was also a public health doctor, you can't help but being a little bit scared by what you hear in the news. So it's really good to hear your story. Thank you.
That actually, Leo, that's actually the reason why I'm doing this, is more because one of my patients, my patients are emailing me all the time. One of them sends me this thing from a well-known magazine, and it basically, the entire magazine article went, this is how corona will kill you, and then went through every bad way you end up with a cytokine storm, you end up getting ARDS, you end up dying. And I was like, that mathematically that's not the likelihood. Yes. The mathematics of this are that if you are young, you've got about 1 in 300 are going to die. Now, obviously, I'd rather it would be 0 in 300. But the point is that that's not how this is being portrayed. But I understand why they're doing that, because if people obviously shirk this, then the people who really will die, because it's by the time you're 80, you have a 1 in 7 chance of this killing you. So I'm doing this for my mother and father because they, God bless her, in the 70s and 80s. This is not something any of them need to get, because this will be a different outcome for mine.
Yes, absolutely. So moving on from that, I think is a great question to ask. How do we as individuals take responsibility for our health and do all we can to boost our immune system to reduce the risk of catching this virus or getting sick from it?
So, I have to say that there are certainly in integrative medicine, which is my area of interest and focus, there are botanicals, there are things that you can take, which I will in a second go over, but I want to just take a bigger picture. Your immune system is part of the body, and you're supposed to be caring for your body. If you care for your body, you are born with a performance sports car. How you fuel this performance sports car, how you maintain it, how you move it is going to have an effect. So, frankly, if you're going to get corona, be in the best shape of your life when you get it, because you're much less likely to end up with a bad outcome for bad things to happen. So I think the reason why I was okay is because there was a lot of effort that's been for years, exercising, sleep. I cannot overemphasize the importance of sleep. There is a study that was shown that people who sleep less than 5 hours a night, their risk of developing viruses like rhinovirus, that's just the cold virus, was increased by about between 3 and 4 times compared to people who sleep for 7 or 8 hours. So your sleep has a massive effect on your body because it's a third of your entire life. You better do it properly. Your nutrition is going to be important, and there are multiple foods that are important because they have antiviral properties, not just garlic, not just oregano and rosemary and thyme and basil. These are all herbs that have essential oils that you should be cooking with, because the oils will, and eating, because the oils have lots of compounds that kill viruses. If we have viruses, nature's going to give us the solution, and the solution is going to be in nature. So that's important. The exercise component is actually important. I was looking, it's ironic, I was looking to see, okay, are there any recommendations when you get back to exercise after you've been well, the convalescent stage? And so I decided that when I had no symptoms, I would wait another 24 hours and then I would gently see how it went, which is what I did. And if I still wasn't feeling back to myself, then that's not it. You just wait. You can't exercise when you're sick. But once you are well, off you go, because a fit, healthy body is going to do much better than a body that is unfit, overweight, obese with diabetes. We know that from the Chinese studies. And then the final thing in answer to your question are botanicals. The essential thing is that this is just a regimen that somebody asked me yesterday that is kind of established. It's not miraculous, but there are reasons for them. For example, zinc. It seems to be that 30 milligrams of zinc, which is an easy to get supplement, although apparently it's getting sold out on Amazon, zinc seems to have an effect on reducing the ability of the virus to get into the cells. So that's obviously a useful thing. Vitamin C is potently antiviral and anti-inflammatory. And remembering that inflammation is an awfully important part of this COVID thing. What actually kills a lot of people is not just that they get a viral pneumonia, it's that their immune system gets switched on, which is an inflammatory response, and all of these chemicals you make in your body called cytokines start to go wild, and your body goes nuts. So the inflammatory part is good. So vitamin C actually has anti-inflammatory, antimicrobial effects. Melatonin, not a surprise again. Melatonin is something that is important for normal sleep. And also taking 3 milligrams of melatonin seems to have antiviral properties, perhaps having effects on allowing the virus to settle in the upper respiratory tract. The virus settles up here and then it goes down, which is what happened to me. Elderberry potently increases your immune function. So elderberry extract, a great, great good thing. The one thing I must say is that some of the supplements you have to be a little careful about, because if you actually get the disease, you may want to back off on all these immune stimulating herbs, because you don't want your overstimulation of your immune system. So in the integrative world, people are concerned about taking too much echinacea, which is immune stimulating, taking certain types of Asian mushrooms, taking the elderberry if you do have the COVID, and other types of things that you'd have to be a little careful about, because they have immune stimulating properties. But as a prophylaxis to try and not get it, zinc, melatonin, vitamin C, a gram, maybe some elderberry, and then you need to practice all the social distancing and all the hand washing, and you need to look after yourself. Your body needs to go into this in the best shape if you're going to end up in the best shape.
Excellent advice. Thank you for sharing that. I'd heard some of that information before, but some of that was new as well. And I think it's interesting, like you're saying, about perhaps stopping some of these supplements if you know that you've got the virus, because this virus is acting in a slightly unusual way, and that it sets off this cascade of immune response.
That's right.
Is actually what harms you. So.
Right.
Yeah.
The reaction to this, because the body humans have never experienced this virus. It's called the novel coronavirus because we just have never had it. So our immune system does not know what to do. It switches on. If it switches on too much, you're going to have a problem. If it doesn't switch on, you're going to have a problem. If you get it ready, it'll switch on nicely, and it'll be humans 1, corona 0.
Yes. Excellent. So what should people do if they start to feel, like you mentioned, the kind of scratchy feeling in their throat, or a bit of a sniffle that's, unusual for them? What should they do?
What I'm going to say is that, number one, there are, recommendations. Number one, I think it's important to call your primary so that they can advise you specifically in your case. I don't know whether everybody needs to be tested. At this point, that seems like the horse has already fled the barn on this one. I think that the right, reasonable thing to do is, if you're starting to get that, is to isolate yourself from others and to take the rest and to hydrate and to take Tylenol if you are starting to get a headache. I wouldn't take Motrin or anything. There seems to be some issues with that. Yeah. The red flags that would send you to the emergency department are a high fever, shortness of breath, which is what happened to me, or confusion. If somebody doesn't look good, that is their moment to go to the emergency department. But you do want to be nice about it and be cognizant of others. So what you do is you call the emergency department, you say you think you're on corona isolation, and this is the reason why I'm coming, so that they can be ready, take you in the back way, and you don't have to infect the entire staff. Because if we don't have anybody in the emergency department looking after you, you're going to have even more of a problem.
Indeed, absolutely. Yes, that's very good advice. Thank you. Dr. Joe, any last words of wisdom?
Yes, my last word of wisdom is the following. Integrative medicine is looking at how you eat, how you sleep, how you move, how you deal with stress, and how you connect with others. COVID is actually an opportunity, and I personally found this to be a great opportunity. I've connected with people I have not spoken to in 30 years. Friends from medical school, friends from boarding school in England 40 years ago. And this is all because we've all had an opportunity to suddenly slow down. I now, next week, will not be slowing down. I will be speeding up and getting back onto it, because there is a lot of people, and with the grace of God, I'm okay. I'm also immune, I believe. So I can actually look after these people with a little bit less concern, but connect with others, because it's important for you and it's important for them.
Yes, absolutely. And I think this is nobody would have wished this outbreak on the world, but there are opportunities that are coming from this virus if we choose to take them, to make the world a better place. And just want to thank you on behalf of the community for all the amazing work you do. Stay well and take care, and goodbye for now.
Absolutely. Take care, sweetie. Bye.
Bye.